Welcome to the podcast, The Connected Journey, Life with IC, where in each episode I talk to a person living with interstitial cystitis and take some time to explore one piece of their story and their journey with IC. This is your host, Laura Santurri, and I'm glad you're here. All right, well, welcome, Kristin, to the podcast. Thank you so much for being here. We're going to jump right into questions. So I wonder if we could get started by having you introduce yourself. And then as I ask all guests, if you could tell us about the moment that you first found out that you had IC.
Sure. Well, as you mentioned, my name is Kristin, and I live in the Chicago suburbs. And I've been diagnosed with IC for about 14 years. It'll be 14 years next month. And I kind of got to my IC diagnosis through endometriosis. So I had been seeing a doctor in the area for, I don't know, maybe a year and a half. And she kind of came to the end of what she could do for me and actually referred me to a physician up in Milwaukee, Wisconsin. So when I saw him for the first time and I explained my symptoms, he actually, like on the spot, scheduled me for surgery for endometriosis to remove the different pockets of it within my abdomen. And then he kind of casually, I guess as casually as you could, mentioned that it sounded like I may also have interstitial cystitis. And I was just like, okay.
What a thing to just drop on someone. Hey, by the way.
Right. And all he said was, you may have interstitial cystitis. He didn't say what it was. He just said the name. And so I was like, okay, I guess I'll go look this up. So when I looked it up when I got home, that's kind of when the full weight of it hit me, because it was like, this is incurable and patients that have this have a terrible quality of life. And I was like, what just happened? So
Yeah.
fast forward a couple of months after that, I had the surgery, and as part of the surgery, they did a hydrodistension and a cystoscopy. And so the cystoscopy showed that I did have interstitial cystitis. So I was formally diagnosed with it at that point, and I guess the rest is history.
I think you are certainly not alone in the story. I think so many of us also have these comorbid conditions. Like I also have endometriosis, and that was actually diagnosed prior to the IC. I was dealing with that before I got the official diagnosis. And the piece around really not having it explained to you. I was actually just recording another podcast episode with someone else, and I asked her, I said, what do you remember about how it was explained to you when you were diagnosed? And she was like, you know what? I don't think it was explained. So like at the second like formal diagnosis point, did you get an explanation from your providers then?
No, they just told me that they had done the type of testing that they needed to do in order to formally diagnose me. And I had a follow-up appointment fairly quickly, I would say probably within the same month. And at that point, it was kind of explained, but it was more like, okay, here's the diet, and here's Almiron, and in general, this is what we do. This is 2011, so obviously some of the treatments that are available now weren't available then, but it was kind of like, I had thought for a long time that interstitial cystitis is this group of symptoms, and we all experience it the same way. And that's how it was treated by doctors for me for a long time until recently.
And we wind up being so different, truly. I mean, obviously, we all have some overlapping things that kind of help us, under this umbrella of IC. But, some of us are affected by diet, some of us are not. It can be really variable. And I know for me, when I first was exploring what it meant to have this condition, and I saw those things, it made me feel like, do I have IC, for example, because diet doesn't affect me. And so it took me a while to find other people for whom that was the same. So it can be really quite variable.
Yes.
Yeah. But I do
That's
think that one of the shared similarities for us is that, for a lot of us, is that quite a bit of the burden of figuring out what to do and how to take care of ourselves falls on us.
absolutely. And that's what makes it so difficult.
Yeah. For sure. So when we first talked, you brought up pain reprocessing therapy. And so I want to take a deep dive on that. And so to start with, for listeners who are not familiar, can you share in your own words what pain reprocessing therapy is?
Sure. So when I think of pain reprocessing therapy, I think of a tool that I am using in order to um, look at my pain in a different way. Um, Basically, it's something that you can use to identify your fears and identify your internal protectors that you have learned to deal with so that you could cope with specifically interstitial cystitis, and kind of discover how to work with them, I would say. So, for me, how I understand pain reprocessing therapy is that in general, it helps to rewire the neural pathways in your brain that interpret pain. Because with the science that backs PRT, basically what's happening is that you are experiencing a sensation, and that sensation could be painful, but it also could be completely neutral. But your brain has been wired to automatically kind of jump to conclusions. And so when you experience a sensation, um, your neural pathways um, that that like encourage your brain to send a pain signal are just very well worn, I guess I could say.
Yeah,
And so that's kind of what happens. So you are trying to get your brain to not go down that neural pathway and to instead kind of take a split second when you do have some kind of sensation and um, form a new neural pathway that does not go directly to pain.
that's a great explanation. Thank you for that. I often tell folks who I'm talking to about this that when I'm trying to explain what an upregulated nervous system is, I often just say, like, look, it's like having a house alarm that goes off when a leaf blows down the street. Um, but that your explanation was much better than mine. So tell me, how did you first learn about PRT? How did you find it?
Well, I first found Callie's podcast,
Yeah.
the ICU podcast, and so I've been listening to that for over a year now. I think she was in season 3 when I found her podcast, and in season 4 that she's currently in, she has definitely gone into the upregulated nervous system, essential sensitization, root cause, a lot more and explored that because I think that that's something that in general people aren't super familiar with.
Right.
And so, actually, I think it was 2 of the episodes in the current season. He had the authors of the Pain Reprocessing Therapy workbook as guests on her podcast, and so they really kind of opened my eyes because they explained how the concepts that are associated with pain reprocessing therapy could be helpful in addressing IC symptoms.
Yeah. So I'm wondering about your initial thoughts about PRT when you started to hear about it, because I know, for context, when I first started learning about it, there was a piece of me that was, well, I'm always kind of skeptical in the true sense of the word, like, show me the evidence. But there was a piece of me too that felt almost like a little bit defensive because I have in my past experienced discussions with healthcare providers where I felt like I was being told that I was crazy or that it was in my head. And this is actually a little bit in your head in the sense that your brain is in your head, right? But not that you're crazy. So how did you first react to it when you heard about it?
Um, it's interesting because I can totally understand that reaction, but I didn't have that reaction. Um, it was, I guess it was kind of explained in a sense of like that if your nervous system being in fight or flight 24/7 is your root cause, then this can help you. And when I heard the explanation of it, I just really never had felt quite as seen as I did
Oh, that's
then
great.
of like, oh my gosh, like they literally just explained me and they literally just said, how I experienced my symptoms and everything like that. It was almost like somebody was reading my mind. And so I kind of have always just looked at it as another tool. Um, and like you said, like it does um, involve the brain, but it's also involving like, it's not just saying it's all in your head. It's saying, you know, take a look at your experiences and take a look at how this this chronic pain disease has affected you, and use these tools to learn to relate to it in a different way.
Ah, that's a great way to explain it. I love that. So tell me about how you have integrated PRT into your life.
Um, so in general, I've just been trying to be a little bit more thoughtful of or more mindful, I should say, of my thought patterns and beliefs. Because there is kind of a, I guess I could say, like a tangential concept of like predictive coding. And so, obviously, having IC for 14 years, my brain is used to automatically jumping to, oh, well, that's a symptom of IC. And in general, that's a bad thing. I don't want to have IC. I don't think any of us do.
Right.
And so, that's like a tick in the negative column. And so, just kind of looking at things with a more neutral mindset. And then also turning inward. And that was something that I was surprised that hadn't really occurred to me before. Um, but that is so useful because before, when I would experience symptoms, um, I would do something to distract myself. I would scroll on my phone, I would watch TV, I would just do something so that I wasn't thinking about it, when really that's just like a temporary solution. And turning inward to like really just kind of identify with myself and ask my body, like, what do we need to get through this? That was definitely a perspective shift, and it definitely helped to, I would say, reduce the intensity of the pain, because instead of trying to fight against my body, I was trying to um, kind of befriend it and say, like, okay, I understand this is, not a great experience, but what do we need? How do we get through this?
Oh, I love the phrase befriend your body. That's fantastic. What you're talking about really resonates with me because I know that for me as well, when I started to get better with this condition, one of the things I really worked hard not to do is to not catastrophize. And I'm not a huge fan of that particular word, but I can't think of a better one to describe it because I know for me, whenever like I would start a flare, I would initially always go right to the worst case scenario, like how long this flare is going to last forever. It's incredibly painful. This condition's never going to go away. And for me, I would just kind of spiral. And so one of the things that has been effective for me as well is to really take a moment and be aware of that inclination to catastrophize. And but you're articulating it far better than I could. I love this idea of befriending your body. And I love that you said that you're kind of involved in this process of turning inward. And you talked a little bit about that, but tell me a little bit more about what that means for you. How do you turn inward?
It's very similar to meditation for me. So the way that I meditate, it's mindfulness, but it's also just kind of like progressive relaxation. I
Okay.
do it when I get in bed at night and just try to completely relax my body. And so when I turn inward, I kind of try to do the same thing and see if I can pinpoint exactly where the pain is coming from within my body, because it's very odd, but a lot of times if I can zone in on it, the intensity will decrease. It's almost like it wants to be noticed. And
Mhm.
once you do notice it, then it's like, oh, okay, I don't have to be so intense. And then also, and this is something I learned through pain reprocessing therapy, I try to tune into my feelings and thoughts. And if I am in my head catastrophizing, spiraling, exactly what you just said, then I'll try to just bring myself out of that and say, we are not feeling well right now. And what are we going to do to help that? Can we go get a heating pad? Can we drink a cup of tea? What's going to help instead of sitting here in this spiral and um, kind of just feeling bad for myself.
I love how you're describing kind of this process of talking to yourself and comforting yourself. This actually makes me think a little bit about something that I do when I run. Because one of the things I've learned from some of the coaches I've interacted with over time is it will be painful at times. If you're doing long runs, it will hurt. And so one of the things you can do is to just lean in and acknowledge, like, hey, my calf hurts right now, but like that's okay. Like I'm still safe, and eventually that's going to go away. Like it's not going to last forever. And it's very similar, I think, to the type of kind of self-talk that you're describing as well, which I love. That really resonates with me. Um, when you first learned about PRT, well, first of all, tell me a little bit about, so you mentioned Callie's podcast. Have you gone anywhere else to learn more about PRT or how to do it?
Yes. So that kind of started off like a deep dive into PRT for me.
Okay.
So through the podcast, the authors of the Pain Reprocessing Therapy workbook announced that they were going to do a group therapy, not really therapy, but just kind of like a group, um, more of like learning
Yeah.
about PRT. And so I actually signed up for that. And it was 10 weeks over the summer. We met once a week. And I had never participated in a group before for therapy or for really anything else related to interstitial cystitis. Um, and so our first meeting was, introducing ourselves and talking about what kind of chronic pain we had. And I was kind of surprised that I was the only person with interstitial cystitis in the group. There were people that had migraines, people that had more of a fibromyalgia, all over type of pain. And so throughout the 10 weeks of the group, we kind of went through the workbook step by step. They introduced the concepts and explained them, but also um, it was really beneficial for me to see how other people could apply them to their specific
Yeah.
situations. And so that kind of helped me really understand PRT as a whole and really kind of like dive in head first, I guess I could say. And we were able to share all of our experiences and get advice through the group. And it was just really, really a great experience. And so I think they're planning on doing it again, but I don't think they've announced when. But I would say for anybody who's interested, it's definitely a great opportunity.
It sounds like it was a very validating experience.
Very, very.
I think it can be really helpful to be around other people who experience something similar, even if it's not exactly the same. And in some ways, like you said, I think it can be helpful to hear from people who come from it from a different perspective as well. But
Yes.
that's great. Um, were there any parts of the process as you were learning about PRT that you found surprising or challenging?
Well, it was interesting. I don't know if I would call it surprising, but there were a couple parts of it that just made so much sense that I kind of like made a big leap in my understanding of it and in how I perceive I see. One of those was preoccupation and rumination.
Yeah.
Obviously, that's part of catastrophizing, that's part of spiraling. And we talked about it. Like at the end of one of the sessions, it was introduced. And just hearing someone say, like, this is a valid part of your experience, it was almost like my brain was like, cool. And now that we, are not the only person on earth that does this, now we don't have to do it anymore. And I think that's a real strength of pain reprocessing therapy as well, is that what we experience on the inside is sometimes hard to explain. And
Yeah.
also sometimes we feel like shame around explaining it, and we feel that maybe we're weak, or maybe people will think we're crazy if we explain what
Mhm.
we're feeling. And so, like you said, it is so beyond validating, because most people with chronic pain, not even just interstitial cystitis, but chronic pain in general, have very, very shared experiences. So that's another just huge benefit that I got from the group.
That's great. I know when I first started learning about this as well, like it so resonates with me what you said about like making this huge leap after hearing something. It was like once I understood it was like someone flipped a switch in me. And the way that I
Yes.
describe it is it was a fundamental paradigm shift. Because for me, I had always thought, well, there's something wrong with my bladder. And so I need someone to fix my bladder. But right now, the science isn't there and they can't fix my bladder. And so it was like, okay, well, what can I possibly do then? And when I learned about this, it was a complete shift in obviously thinking about what would be the root cause of my symptoms. And then all of a sudden, I had control over things. It was like, I don't
Yes.
have to wait for someone to fix my bladder or come up with a special medication or whatever. It was like, I have control over this. And I always tell people when I talk about it, it's never to imply that we bear the sole responsibility of our care just because we do have control over it, but it just opened up so many more doors for me. And it was life changing when I learned about it.
Yes, I had the same experience. The control, and I think because a lot of us are more type A, and kind of do go towards that, upregulated nervous system, the control is just huge. At least feeling like you have some semblance of control.
Absolutely. Yeah. And it works wonders for building self confidence and self efficacy. Um, yeah, big changes. So you mentioned the group from the authors of the book, but if somebody is listening and saying, I'd really like to learn more about this, what resources would you recommend to them?
I would absolutely recommend the book. It is very easy to read. The way they explain things is just so, I don't want to say layman's terms, because it's not really necessarily layman's terms. It's just they use a lot of examples, I guess I could say, and that makes it so much more understandable. And then I also wrote down a few podcasts and websites that have helped me as well. So as far as podcasts, the Heal with Grace podcast, I believe Grace is one of the people that works with Kelly. And I like her podcast, Grace's podcast, because she explains these concepts in another different way. And I think with these concepts, the more you learn how they're applied, the better you understand them. Because, again, a lot of us, even with different types of diagnoses, have shared experiences.
Yeah.
The Like Mind, Like Body podcast, that is associated with Curable. And so they bring in specialists to talk about different parts of pain reprocessing therapy and how they relate. And I usually learn quite a bit from that podcast, um, just because, like, these are specialists that I don't know that I would have thought to e- even like include in my chronic pain journey. And then the Pain Reprocessing Therapy podcast, that's an interesting podcast because they actually record a pain reprocessing therapy session with a patient. And during the podcast, they'll play snippets of the session, and then the host will be joined by another pain reprocessing therapy practitioner, and they'll kind of dissect the snippets of the session and say, like, what they think is going on, and what, the person is saying this, but it really could be that they're feeling this way, or they have this type of protector, or they have this type of belief. And so they'll kind of explain how they get the the person to kind of move past whatever roadblock they might have. And
Yeah,
it's just an interesting way of looking at pain reprocessing therapy.
those are some great resources, and I will link to all of those in the show notes as well. Those are great. It's a great list.
Yeah, and then I also had a website,
Oh,
painreprocessingtherapy.com. It's literally all one word, painreprocessingtherapy.com. And that very much like the workbook explains the concepts very easily. And you can also sign up for a newsletter, and it's usually on a weekly basis. And the newsletter delves into a specific topic related to pain reprocessing therapy. And I found those to be very interesting as well. And they also provide additional resources within the newsletter. So I found it valuable to read every week.
excellent. Great. I will add that to the list. So when we first talked, you also talked a little bit about identity. And I thought that was a really interesting thing. And so I wanted to also ask you a few questions about that. So tell me, how do you think living with chronic pain has changed you as a person?
It has changed me a lot.
It's
um,
a big question, right?
it's a really big question because it's been 14 years since I've gotten the diagnosis. And even if I didn't have this diagnosis, I would have changed a lot in 14
Sure.
years. That's a long time. So, um, specifically, how living with interstitial cystitis and chronic pain, um, it does help me to see the silver lining in things at times and have a little bit more gratitude for the small things in life. One of the things that I always kind of joke about for silver lining is like anytime I have to do a blood test, even for like my my work program that I sign up for and I get points during the year and then I get money off on my insurance. Like if I just do a blood test for that, that's like cholesterol and sugar, A1C, all of that. My blood test usually comes back pretty good because I don't really eat a lot of garbage. So I'm like, okay, well, kind of being diet sensitive has kind of turned me towards a little bit healthier eating. So that's a silver
Hmm.
lining. And then just my meditation as well. I started meditating 10 years ago, and I'm not sure I would have done that if I didn't have IC. And that has really helped me overall, and has helped me be calm in stressful situations, both in my personal life and at work. So that's another kind of just little um, positive thing in the overall in my overall life with interstitial cystitis.
Yeah. When we first talked, you had mentioned that even when we learn to cope, we can't be the person that we were pre-diagnosis. Um, so tell me, have you have you grieved your pre-diagnosis, yourself pre-diagnosis? I know for me, grief is a word that resonates because, and like you, I definitely have found the silver linings, but there have also been things that I feel like I have lost, and there has been a little bit of loss at this journey too. So I'm wondering, when I say the word grief, does that resonate with you?
I actually haven't really resonated with
Okay.
grief.
Okay.
Um, it's so I, for a long time, I kind of thought that like part of the healing within interstitial cystitis is just trying to like undo it. Like,
Mm,
okay, well, I'll just find these things, whether it's medicine or a type of therapy or whatever it might be, that will help me get back to where I was. And then I can just kind of forget about IC and pretend it never happened. And that'd be great. But as far as learning to cope, like, I don't think that, like, my mindset has changed recently, and I don't think that it is about like getting back to where I was pre-diagnosis. It's more about like getting through and finding things that help me so that I can live life the way I want to live it instead of how my diagnosis demands that I live it. But I guess like kind of related to grief, it was odd to me to kind of realize that this diagnosis does have such a profound effect on your life. And even if you do get to a point where you're not experiencing symptoms on a daily basis and you're overall feeling better, it kind of still is something that you'll have to address um, throughout the rest of your life. So,
Yeah, I've always kind of I've grappled a little bit with the language I use around is am I accepting this condition and this diagnosis? Am I celebrating and embracing it even at times because of those silver linings? And I don't know that I've found like a consistent way for me to describe it. But what about for you? Like, is acceptance a word, or do you see it differently?
acceptance is something that I struggled with for a long time,
Mm,
because I felt like if I accepted it, then it means that I gave up and interstitial cystitis had won, and now where was I going to be? And so it took me a long time to realize that acceptance is just kind of the first step towards moving forward.
mm,
And it allows you to stop fighting against it so much and instead, kind of like the turning inward that I mentioned before,
yeah.
and listening and working to find strategies that work for you instead of fighting against it and like stressing yourself out and stressing your body out in that way.
Yeah, when you were talking about that, it made me think about the analogy that I sometimes hear, and there's nothing wrong with it. It's just never resonated very strongly with me, is this idea of being a warrior or being in a battle. And I think that's part of like the whole kind of leaning into this is part of me, and I don't need to fight it. I don't need to battle it. It's part of me. I'm going to figure it out and I'm going to work with it to move forward. Um, but I've always kind of struggled with this idea that I'm battling something or that it's a fight. But I understand that for some people that helps, but for me, it never has. And I think for exactly the reasons you just described.
Yeah. Yeah, I think I used to think of myself more as like a fighter, like you just
Hmm.
described, and um eventually I got to a place where I was like, this just isn't serving me. Like I
Yeah,
have to relate to this in a different way.
absolutely. Yeah. So in thinking about kind of your life, kind of learning, being on this journey with chronic pain and with IC, are there parts of yourselves that you've discovered or de developed that you value?
One of the things that comes to mind right away is it has definitely m- made me learn, I guess I could say, how to stand up for myself and advocate for myself, kind of within every aspect of my life, but especially with healthcare providers. I think a lot of us have that experience of being um, kind of not listened to. I know that it wasn't even specifically related to interstitial cystitis, but when I was trying to figure out, how to get through endometriosis, I did have practitioners that I went to that told me that this was all in my head, and that I either just needed to learn how to deal with it, or that, I shouldn't be drug seeking, which at no
Oh,
point was I
geez.
ever drug seeking. So that was an interesting reaction. Um, and I also, even though like, I don't even though I try to now see myself as just I'm dealing with this and I'm working with my body, in my past of fighting this and of saying, I'm going to quote beat it. I do think it made me a stronger person overall because when I look back at it, it's kind of just like no matter how hard it's been, I've gotten through it in some way, shape, or form. So I guess I'm resilient.
I think resilient is a great way to describe most of us with this condition. And I know for me, I have become over time, and I'm not perfect. I still have things to learn and progress to make, but I definitely have learned to trust myself more in this process because early on in my journey, I was dismissed quite a bit by healthcare providers, especially because my symptoms started when I was a teenager. So I was just this young girl trying to navigate the healthcare system, and I didn't always get treated with respect by the healthcare community, unfortunately. And I learned at that time, like, oh, geez, well, maybe I am making this up, or maybe I am. Is there a part of me that wants attention, and that's why I'm here? And over time, I learned that no, just no. And when I feel something or I think there's something wrong, I can trust myself and I can advocate for myself. Um, so yeah, another silver lining in the journey, I guess.
Yeah, and also it's interesting that you say trust because trust is one thing that I recently was able to do with my body. Because I always felt like if I had a big presentation at work or if I was going on vacation, it was always this, oh man, I hope I feel good. And I was all in my head about it. And I felt like I couldn't trust my body, like it was going to do something that I wasn't going to be able to be quote in control of. And now with PRT and through some of the tools that it's taught me, I feel like I am like I guess like mentally connected with my body, and it's not this question of, oh no, like what am I going to do if I have a flare, and what am I going to do to not get a flare, and just worrying so much that has helped a lot to decrease the rumination, decrease the worry, is just establishing trust within your own body.
Yeah, and not see your body as an adversary.
Yes,
It's
yes,
you, and
yes.
you can work with you. And even if, for example, you go on vacation and you have a little bit of a flare, like to trust yourself to be able to work with it and figure it out.
Yes.
Yeah. So, is there anything else that we haven't talked about that you'd like to share about PRT, about identity, or anything else about living with IC?
I think the only thing that we haven't talked about is just support,
Yeah.
that it's important to have support. Um, I, for a while, did not have great support from like a work aspect. I worked at a place where they thought that I was making it up. I'm not even joking. They thought I was making it up. And that just, it just is so painful
Mhm.
when you're dealing with it personally, and it's such like a mental injury, I guess I could say,
Yeah.
that nobody believes you. And it was very high stress, and my symptoms just ramped up to the highest they had been. So now I work at a place where they do value work-life balance, and they're willing to support if you do have a chronic health condition. And so that makes a humongous difference. And then support within your personal life, whether it's family, friends, loved ones. It's not that they have to go through it with you or even believe everything you say about it, but it's just that they need to not drag you down. They can offer advice, they can give you their perspective, but as long as they're not dragging you down, I think that's important.
Yeah, I've often said that, the kind of support that I need is not that I need someone to fix this for me or come up with another idea. It's more about just listening, validating, and even just expressing a bit of empathy or sympathy goes a really long way.
Absolutely.
Yeah. So, as I ask all guests at the end, if you were sitting across from someone who is newly diagnosed with IC, what would you say to them?
I often think that, man, wouldn't it have been great to know as much as I know now when I was newly diagnosed?
Me
And it didn't
too.
take me 14 years to get here. But definitely my first thing would be, don't be afraid to advocate for yourself because nobody else is going to do it for you. And to try to find resources that are evidence based and that can help you learn as much as possible about interstitial cystitis, learn about treatment options, and then also now that the phenotypes have kind of become a thing, to kind of learn. You don't have to identify with specifically one or another, but kind of learn the traits and the symptoms that people who are categorized as different phenotypes are experiencing, so that you can kind of try to figure out, okay, where do I fall within this? And then what's going to help me the most?
I think that's fantastic advice. Well, Kristin, thank you so much for being willing to spend some time with me and share a little bit of your journey. I'm so glad you were able to join.
Yeah, this is fun.
Thanks for listening to this episode of The Connected Journey, Life with IC, where we work to defeat isolation one story at a time. Until our next episode, should you find yourself in need of resources, I encourage you to connect with the ICA at ichelp.org. Thanks all, and take good care.